Hello and welcome. Today we're diving into squamous cell carcinoma of the urinary system. This less common but serious cancer can affect various parts of the urinary tract. We'll explore its causes, how it develops, its symptoms, diagnosis, treatment, and what the future holds in terms of research. Let's get started. The exact cause of squamous cell carcinoma in the urinary system, particularly in the bladder, is not fully understood, but certain risk factors significantly increase the likelihood of developing this cancer. Chronic irritation and inflammation, often due to long-term bladder infections. Bladder stones or prolonged catheter use are major contributors. Schistosomiasis, a parasitic infection common in some parts of the world, is a well-established risk factor, especially for bladder cancer. Exposure to certain chemicals, particularly aromatic amines found in dyes, and the rubber industry is also implicated. Smoking is strongly linked, as it exposes the body to carcinogens that are excreted in the urine. Lastly, immunosuppression, whether due to medications or underlying conditions, can elevate the risk. Squamous cell carcinoma begins with changes in the squamous cells, which are thin, flat cells lining the urinary tract. Chronic irritation or inflammation leads to dysplasia, meaning the cells start to grow abnormally. Over time, these dysplastic cells can accumulate genetic mutations that drive uncontrolled growth and proliferation. This process transforms normal squamous cells into malignant squamous cells. The cancerous cells can then invade deeper layers of the urinary tract wall, eventually spreading to nearby tissues, lymph nodes, and even distant organs if left untreated. This invasion and metastasis are the hallmarks of cancer progression. Squamous cell carcinoma is not the most common type of urinary cancer. It accounts for a smaller percentage of bladder cancers compared to urothelial carcinoma, also known as transitional cell carcinoma. The exact incidence varies geographically, with higher rates observed in regions where schistosomiasis is prevalent. Factors such as age, smoking habits, and occupational exposures contribute to the overall risk within different populations. While rare in developed countries, accounting for only around 3–5% of bladder cancers, it's crucial to remember the impact of schistosomiasis globally, where it represents a significantly higher proportion. The signs and symptoms of squamous cell carcinoma in the urinary system can be varied and often mimic those of other urinary conditions, making early diagnosis challenging. The most common symptom is hematuria, or blood in the urine, which can be visible or microscopic. Other symptoms include frequent urination, a persistent urge to urinate, pain during urination, lower back pain, and pelvic pain. In advanced stages, symptoms may also include weight loss, fatigue, and swelling in the legs due to lymph node involvement. It's important to consult a healthcare professional promptly if you experience any of these symptoms, especially hematuria, as it could indicate a range of urinary tract issues. Diagnosing squamous cell carcinoma involves a comprehensive evaluation. This typically begins with a thorough medical history and physical examination, followed by urine tests to detect blood or abnormal cells. A cystoscopy, where a thin, flexible tube with a camera is inserted into the bladder, allows the doctor to visually inspect the bladder lining for abnormalities. Imaging tests like CT scans, MRI, or intravenous pyelograms (IVP) help determine the extent of the cancer and whether it has spread. A biopsy, where a small tissue sample is taken from any suspicious areas, is crucial for confirming the diagnosis and determining the type and grade of the cancer. The grade indicates how aggressive the cancer cells are. While specific subtypes of squamous cell carcinoma are not as clearly defined as in some other cancers, the staging of the cancer, according to the TM system, tumor, metastasis, is crucial for guiding treatment decisions. The T stage describes the size and extent of the primary tumor. The N stage indicates whether the cancer has spread to nearby lymph nodes. The M stage signifies whether the cancer has metastasized to distant organs. Based on the TM stage, the cancer is assigned an overall stage, ranging from stage 0 to stage IV, with higher stages indicating more advanced disease. Treatment for squamous cell carcinoma of the urinary system depends on the stage and location of the cancer, as well as the patient's overall health. Surgery is often the primary treatment, especially for localized tumors. This may involve partial or radical cystectomy, which is the removal of part or all of the bladder. Chemotherapy may be used to shrink the tumor before surgery, kill any remaining cancer cells after surgery, or treat advanced cancer that has spread. Radiation therapy can also be used to target cancer cells, either alone or in combination with surgery and chemotherapy. Immunotherapy, which harnesses the body's own immune system to fight cancer, is becoming increasingly important, especially for advanced disease. Finally, reconstructive surgery may be needed to restore urinary function after bladder removal. Preventing squamous cell carcinoma involves minimizing exposure to known risk factors. The most important step is to quit smoking, Preventing and treating chronic urinary tract infections is also essential. Avoiding exposure to industrial chemicals, such as aromatic amines, is crucial, especially in occupational settings. In regions where schistosomiasis is endemic, regular screening and treatment are important. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also contribute to overall health and potentially reduce cancer risk. The prognosis for squamous cell carcinoma of the urinary system varies significantly depending on the stage at diagnosis, the patient's overall health, and the response to treatment. Early-stage cancers that are confined to the bladder wall have a better prognosis than advanced cancers that have spread to lymph nodes or distant organs. Recent research is focused on developing more effective targeted therapies and immunotherapies to improve outcomes for patients with advanced disease. Ongoing clinical trials are exploring new combinations of treatments and novel approaches to target specific molecular pathways involved in cancer development. The future holds promise for improved diagnostic and therapeutic strategies, leading to better outcomes for patients with squamous cell carcinoma of the urinary system. Always consult your doctor for personalized information regarding your specific case and treatment options.